Good morning, everyone. My name is Matt Corser. I'm a member of the facilitation team of Ohio's Center of Excellence, or Prevention Center of Excellence. I'm honored to be here today to facilitate a conversation with 5 of Ohio's leaders in prevention. And the goal of this discussion is for our panelists to provide insights on how they led their community through efforts over the last 2 years to actualize the Healthy People 2030 goal related to social determinants of health. And that is to create social, physical, and economic environments that promote attaining the full potential of health and well-being for all. Today we're going to explore the ideas and experiences of our panelists as they mobilized and led their communities. They were focused really on addressing social determinants of health, and in doing so, improving health equity outcomes in behavioral health. We're also going to explore their experiences working collaboratively with their community members to address both those upstream factors and also to focus on those social determinants of health. While we have worked together for quite some time, both during and post-COVID, a good starting point would be for each of our panelists to briefly introduce themselves, to say who they are, what their role is, and what community they're from. So, starting with you, Martina, could you tell us who you are and how long have you been working in prevention, and a little bit about your role in Butler County?
Yes, my name is Martina Weber, and I'm the Director of Addiction Services at the Butler County Mental Health and Addiction Recovery Services Board. I've been with the board for 5 years, and I've been in the prevention behavioral health world for about 15 years.
Yeah.
My name is Alicia Longmire. I'm from Hamilton County and reside in Cincinnati. And I'm part of the Prevention First group. It's actually a coalition-based agency and now has grown into a regional nonprofit. And we service not only Ohio, but Kentucky and Indiana. I've been in prevention going on 25, over 30, close to 30 years. So I've been here a while. Thank you.
Hi everyone, my name is Tazeen Ahmed. I am the Senior Program Coordinator for the Montgomery County Alcohol, Drug Addiction, and Mental Health Services Board. A very high level of what my role is to bring all the different services and providers that we have in Montgomery County to be able to address the diverse demographic that makes up Montgomery County citizens. And we do that across the behavioral health continuum of care. And I've been in the field of prevention for a little over 7 years now.
Hello everyone, my name is Tanya Burney and I'm the Director of Prevention Services for the Mental Health and Addiction Recovery Services Board of Lorain County. I have been at the board for about 3 years now, but I've been in the field of prevention for over 25 years.
Hi, I'm Valerie Burney. I'm from Mahoning County Mental Health and Recovery Board. I'm the Community Engagement and Outreach Coordinator there, and I have been working in prevention for probably over 20 years now.
Great. When we began our work together, one of our first tasks, as you saw in the videos, was to draft an impact statement. But before that, there was an even more basic task that we had to tackle, and that was, how do we get started in addressing the social determinants of health? Where do you start? They're big issues. They can seem very daunting. So with this discussion today, we're going to start at the beginning. And my first question to our panel is this: what were some of the challenges your community faced related to the social determinants of health, and how has your community changed because of your work? Tazeen, I think we're going to start with you.
All right. So in Montgomery County, we led our work through what we refer to as our Health Equity Steering Committee. Our Health Equity Steering Committee, and we work really hard together to make sure that we have representation from the 12 sectors of the community, and we define that how CDC defines the 12 sectors of the community. As different individuals, different perspectives, different backgrounds, and the diversity of Montgomery County came together, we started off by understanding that we all needed to speak the same language and come from a shared understanding of what we meant by the initiatives that we wanted to work on. So when we came to the table together to start the CCIM4C 2.0 initiative, our community was very intentional about looking at strategies at different levels, both micro and macro, and understanding that those need to occur simultaneously, as well as understanding that the pieces of behavioral health system have to operate in conjunction for them to be successful and for us to be able to make a difference in our community at those different levels with every sector of the community involved. And with that knowledge is really where we began our journey and came together to face the challenges where when we spoke a shared language, we were able to overcome any differences and barriers that we had.
Well, thank you, Dazine. Valerie, how did you get started?
Well, we looked at Goalie Stennis, she's here, and we began to look at the work that we had already been doing in Mahoning County and the city of Youngstown. She's the minority health director there, and there are huge health disparities in minority and underserved populations, and the stigmas are enormous into accessing care, especially around mental health. And so that's where we wanted to start and focus on reducing those stigmas. And then later on, we added on to our work group members that are here of the Hispanic community, because those stigmas are very real in the Hispanic community. And so now we are partnering together to help reduce stigmas by providing resources and information.
Great. And Tanya, could you share a little bit about your process of getting started and some of the challenges your community faced?
Well, in the beginning, some of the challenges that we faced as a community is that we have a lot of different coalitions, and we kind of worked in silos. So one of the things that with our partnership with Public Health, Lorraine County Public Health, we decided to come together and provide education for all of our coalitions so that we could come together and align our plans together and really move forward on social determinants of health. In doing so, we realized that there was two different areas that we wanted to focus on, and that was our urban and our rural areas. We felt that those particular areas had underserved populations that we needed to address and work together. We decided to devise a summit, and that has eventually brought a lot of our coalitions together to work together. We currently have about 9 entities working and moving forward with our planning process for social determinants of health for Lorraine County.
Great. Thank you so much for sharing that process of getting started. One of the things that's really come through with what you've shared is the importance of those community partnerships as we're working to address those social determinants of health. So my next question to our panelists is, what were the most important things that you learned as you and your communities engaged in this work? Martina, would you like to get us started?
Sure. I've learned that sometimes it's not easy working with other partners in the community. So you really have to get the buy-in and the trust of the folks that you're trying to engage with, especially within the other community providers. And Envision Partnerships, which is one of our prevention, actually our lead prevention agency in Butler County, really was able to help get people on board with our project and share the needs for our Spanish-speaking folks in Butler County, that they really weren't getting the access to care and the access to prevention services that they truly needed. And we were able to do this work together. And what we did was we formed a group, both Butler County Mental Health Board and Envision Partnerships. And we reached out to some of our folks who were embedded into the Hispanic population in Butler County. And one of those individuals was Father Pucky, and he is presented in our video as well. And he was able to share with us some of the limitations that our Hispanic population had. And it was really great to see that it took some time to get there, but we were able to get some folks really on board and really invested in the work we were doing in Butler County.
Thank you, Martina. Alicia, do you want to share a little bit about some of the important things that you and your community have learned?
Yes, like Martina was just talking about, it really, we started out, my piece is I'm part of a community coalition-based agency, so not from the mental health board perspective, but I got a great partner. Carrie was able to come with us with Prevention First and figure out, like, since we were the people that were part of our community, how to leverage what we already had as building a coalition base for Hamilton County. And it was really interesting because when we were getting together, we tried to figure out what part of our community needed the most resources, access, and we figured out it wasn't just the part of the community, or Hamilton County, which is very large. It's one of the largest counties here in Ohio. We see there was a population, there was a group that needed support more than just a section of our community. And that helped me, for me, it's seeing the community coalition connection and that relationship that we had with already existing allowed us to approach that that group to address their problems. And our problem that we thought at first was just like, let's look at the rising rate of Black male suicide. Let's look at the whole piece around opioid overdose that was emerging around the Black males. And then we looked like, wait, why is it a problem? One problem, we gotta almost look at the whole group and see what is going on. And that's how I think those community coalitions and those connections worked out. And we were able to work with the mental health board and came along, and that provided some validity and some kind of like context to it, because that funder allowed those other groups and agencies to say, hey, if they're getting backing from the county, then we can definitely get on board and trust that this agency is going to help drive the social determinants of health statement. Mm-hmm.
Thanks, Alicia. And Tanya, would you like to share a little bit about some of the things that you and your community have learned?
I think the biggest thing or biggest takeaway from our community is knowing that even though we get different funding sources or funding streams, we are working on social determinants of health from a different perspective. I think before we had began, it was like, oh, you have funding for this and another organization have funding for this, and we thought we were doing the same thing, but we weren't. And when we were able to appreciate each coalition and each agency's mission and how they were addressing it, we saw that it was different and that there were gaps that still needed to be filled in our community. So I think we learned how to work together, but then also how to bring it together. And that's a whole different aspect for our county.
Our conversation so far has really highlighted the importance of leadership and also of partnership, and it reminds us too that our working at the community level is hard, and addressing those social determinants of health is hard work. The next question I have really relates to your why, and it's what has been the value to your community of your focused work to address the social determinants of health? Alicia, could you get us started?
I think for me, as just on a personal standpoint, looking at what I do for prevention, I looked at it as my why is because I want to make sure that the future of our county is sustained. And I want to, as we see there's a group of that is not really getting resources necessary. They may be there, and in our community, Hamilton County is robust with so many resources that it appears like, okay, why is there a problem related to this? And then it's more than that. It's not just looking at those resources. It's who's leveraging or who's utilizing them. Do they know how to approach a community resource and say, hey, we need help. If we got mental health issues, how do we know there's a mental health board that even exists? How do we know there's a prevention first that exists? So I think for me, that was the why. Our group came together and looked at if we're going to make sure we prevent, we got to move upstream and make sure that if we're looking at our Black males and what's going on, we got to look at also Latino males as well. We got to make sure that we're not just starting and stopping going and looking at one problem, but looking at the entire group that is being affected. So that's my why.
Thank you. And Desine, as you've worked in Montgomery County, what has been the value for Montgomery County of this work?
Yeah, so I think in our community, the value can really be defined as unity and connectedness. And I think that speaks truth in the work that we continue to do moving forward. So for example, we've done a lot around mental health first aid in the equity sector, in the food equity sector. And so working along and seeing different frames of reference of how people came to the food equity sector, but looked at food in different lenses and how providing mental health first aid to the workers, which we showed in the interviews in our video, demonstrated how having a different perspective of how we've given mental health first aid classes to our prevention providers and given them the opportunities to be able to experience what food resources we have in our community, and then how they're able to then talk about those experiences to the individuals they serve in the community, as well as giving that same training to individuals that actually work within those food resources, and then the services that they're able to provide through the trainings that they have learned and the skill set that they now have, speaks to the volume of how taking the same thing and the same training is impacted differently in the community to different members. And so seeing that interconnectedness of the same thing but being applied in a slight variation to different areas of the community, and that interconnectedness and how that's continuing to build has been really valuable for our community.
Thank you, Desine. And Martina, as you think about this work in Butler County, what's been the value of it for Butler County?
I am going to have to agree that community is really important and communication is really important. So in our project, like I said, in the beginning it was a bit challenging, but as we continued to build trust, it was really great the way we saw our community come together. And in Butler County, we had a Hispanic Heritage Festival, and my partner from Envision Partnerships was able to go to that. And what she saw is that the community came together, but it could have been bigger. There could have been more resources there for our Spanish-speaking folks, and it really shed a light on what we needed to do with our project here with the CCIM4C project. And so what we were able to do was to provide some resources for our folks in Butler County, and one of those resources was a Deterra bag, which is a medication disposal bag, and we were able to translate that resource into Spanish for our Spanish-speaking folks and get that out in our community. So we have spread that throughout our community in libraries, at Envision Partnerships, at the Mental Health Board. So we're putting it in as many places as we can so we can start getting some resources out to our Spanish-speaking folks.
Cool. Well, thanks so much. As we look across our audience today, we know that we have prevention professionals with a wide degree of experience and comfort actually with the social determinants of health. Some of you are just getting started. Others have been working in this space for quite a while. I'd like our panelists to share one or two things that they wish they knew when they started this work on social determinants of health. Valerie, would you like to get us started?
Yes, I wish I knew that this work was so important a long time ago. When I first, started, in prevention and started this work, because it's so important, and like more than genetics, social determinants of health affect, health disparities. They affect everything that we do, and so I wish this work had been in motion. Where were you a long time ago? So, but we're here now, and so it's time to continue to work.
Cool. Thanks, Valerie. Tanya, as you think about this question about things that you wished you would have known as you got started, well, what comes to mind?
I wish I would have known that prevention was bigger than what I thought it was, because in the beginning I thought it should be this way. But after working with the community partnerships and seeing what they brought to the table, I knew prevention was bigger. It was educating, leaders in our community, our mayors, our districts, superintendents, our hospitals, and getting everybody involved at the table. Prevention is big, and we could stretch further and larger, and bringing people together to shift it really made a difference. I wish I would have known that.
Thanks, Tanya. And Alicia, how would you answer that question about something you wish you would have known as you got started?
I think that I agree with the other panelists. I wish I had known that social determinants of health, sometimes I look at it like there's healthy people 2010, healthy people 2020, healthy people 2030. But not everybody knows what those healthy people, those dynamic, where does that come from? Like, where does those measures come from? Where does the LIH and all these big things that come out, like the indicators? It's like, wait, what? This is happening here, and it's right here, accessible to us as preventionists, and versus us looking at just one problem. And I think if I look at all the problems that is happening with our community, and it's how all tied together, we're so siloed, and I would love to have, like everyone else was saying, like addressing all that under that umbrella of social determinants of health. Our funding would look so different. Our relationships will look different. And our territorial maybe behavior could kind of like not be so much. And I think we can get further. So that's my one wish.
Well, thank you. So as we get towards the end of our panel today, I'd like to pose one final question for all of our panelists. And the challenge for you is that we have just a limited amount of time here. The question is that as leaders who have helped your community engage in this work on social determinants of health, how did you and your team respond? Or what did you do when things came up that you didn't expect, or things didn't go quite the way you hoped that they would? Martina, let's start with you.
Well, there were a couple times we wanted to give up, just to be transparent. But we pushed through. Again, I can't say enough about Envision Partnerships, our partner, our biggest partner in this project. So what we did is we said, okay, we're gonna be frustrated for a second, we're gonna feel our feelings, and then we're gonna move on and we're gonna keep pushing, because that's what we need this work to get done. And we need to serve folks who are being underserved in our community. And we saw it with increased overdoses, we've seen it with increased suicides, we've seen it with decreased access to prevention services and to treatment services. So once we kept looking at the numbers, because we did get the data on a pretty regular basis, we decided it's important for us to keep pushing.
Tazeen, how would you answer that question?
I would say for us, we learned that it's an ever-evolving process. And it's actually something that we've adopted into all of our projects going forward, that the plan is never actually the plan. There's supports and there are certain parameters that we have to follow, but that we almost expect to change. And that if we don't expect to change, it means we're not learning through the process. So we actually jokingly call our work group, for example, a living work group, just like a living document, saying that there's gonna be edits, there's gonna be changes, because as we learn through the process, we can't be rigid in our thinking, but rather learning to evolve and learning from our community, our partners, and et cetera, whoever else is at the table, and learning what we don't know and being able to expand and pivot to that. So I would say knowing that it's an ever-evolving process is something that we've learned that's going to guide us in all of our projects going forward.
Cool. Thank you, Tazeen. Alicia, how would you answer that question?
I think I would agree that I looked at within our community, we have work groups already existing. So sometimes it's helpful to go to those leaders and share some difficulties that we were running into. And I think my biggest piece was like going to Carrie, who was my co-director, and saying, okay, how are we going to handle this? Let's hold on, Alicia, keep your head up. We're going to get through this. And I think that really was really helpful to see that there was people that I really didn't normally go to as my go-to persons. Now, sometimes it's internal at your job, but I was able to go to my community and say, hey, this is going on. And it was like, you know, it's going to take time and we need to have patience. Our part of prevention is like, you go and implement things right away. That planning piece is crucial though, and it's really has shown me to be patient and walk through some things. So.
Thank you. And Tanya?
I think for me, realizing that there was ouch moments in that process. I mean, you had workforce shortages, you had COVID, and that all impacted the work that we were doing. And so I think realizing that despite that happening, you have to move forward. You have to keep the impact statement in mind and move forward with it. And it might be that you might be working by yourself for a minute, but putting it out there, asking for support from not only us, but other people, like the consultants was key for us. If I didn't have that, I don't think I would have been able to be here. But to look, if you would have told me then that I would be here now, I would have laughed. I wouldn't have believed it. And I can say that when a community comes together, they come together and they come together hard. And I'm proud of the work that we did.
Cool. Thank you, Tanya. And last but not least, Valerie.
I would say just an example, when we launched our Take That Step campaign, everything that could go wrong that day went wrong. And like the sound wasn't right. The radio station was there, but they couldn't get hooked up to the sound. The director of the venue changed the schedule on us. I mean, again, it was a mess to us, but we had to, Goalie and I, and I thought about it as this is indicative of the life that some of the people that we serve, they live. Things are out, just, they don't understand what's gonna happen next. And, things might be, just up in the air for them. And we had to be motivators. We had to be cheerleaders. Despite what was going on, we had to still keep the program moving, and we had to make sure that nobody else knew that all these things were going wrong. We had to make sure, and so that's how we have to be sometime, even though we know these individuals may not know what's going on, they may not understand, where can I go get help? Where are the resources? And our community partners were right there to make sure, and we just make sure, this is where you can go, this is the help that you need. you know, these are the resources that are available to you. So that was our experience with things going wrong, but we just had to keep moving, you know, keep it moving to make it right for them.
I want to thank our panelists today for sharing their experience and sharing their work and their community's work and really highlighting that for all of us here today at the conference.